Hi, Bob. Thanks for joining me today.
Thank you, Lori. Thanks for having me.
I appreciate that you agreed to talk about reflexology with me. I understand that you're teaching a reflexology class in Metuchen, New Jersey. Is that right?
Am any opportunity to bring reflexology awareness is, really a wonderful thing. And I am teaching it currently at the Academy of Natural Health Science and Wellness in Metuchen, New Jersey.
So, what's your background in?
I am a licensed certified massage therapist. I've actually graduated from the school that I teach at, and that's my formal training. Everything else has just been experience working in clinics and spas.
So, you took a course and took a test to become a massage therapist, and then so you're certified massage therapist. But how about with reflexology? Is there a specific reflexology certification?
No reflexology certification is required to practice in New Jersey. However, it is part of the massage therapy program.
I see. I see. That's very interesting. So, can you talk to me a little bit about the modality of reflexology? How do you define it?
Well, how I would define reflexology is it is a healing system um, that points on the foot, the hands, and the ears will reflex other places in the body, other organs. And by stimulating those points, I can send healing energy, if you will, to those areas to help whatever's going on with the client to resolve.
Oh, that's really interesting. Are we talking about pain management?
In some cases, we are talking about pain management. In other cases, we're talking about stress management, complementary care as far as whatever a client is going through, like injury rehabilitation or digestion issues.
And so you can do reflexology either on the foot, the hand, or the ear. Am I understanding that
That's
correctly?
correct. Generally, the foot is used because people believe that you get a better reaction.
I was
There's
going to
more
ask.
real estate on a foot than a hand or an ear.
Yeah, you don't have much to work with the ear, do you?
No,
But do you teach all three areas?
I do. I concentrate on the foot. Again, the foot is mapped out as far as places that reflex other areas of the body. And it's a little bit easier to see and figure out. But the hand can be used, the ear can be used. According to how the client responds, I would choose one or the other. And of course, like who the client is and what their preferences are.
I see. Have you ever dealt with a skeptic?
All the time. It's very easy to be skeptical of this because at first glance it seems a little bit like magic that I tell you I'm going to work on your sinus issue by working on points on your foot and it's going to work. However, from doing this for a number of years, I've gained experience in seeing it to actually work and that's given me confidence to use this as a modality.
Uh-huh. So let me ask you, what are the most common ailments that you see?
For the most part, I would say it's stress management. There's digestion issues, sleep issues, headaches. I mean, just about anything that you can think of that might be a problem. There might be an area, there is an area that you can work on, let's say. And by work on, I mean, I'm stimulating that area.
Do people ever come in like with their sinuses bothering them or things like that?
In a lot of cases, what I see is people who have run out of ideas. Maybe
Huh.
they've tried massage therapy, they've tried a chiropractor, and they're willing to give anything else a shot. So if I tell them I'm going to work on your foot for a while and clear your sinuses, they're liable to give it a try. And
So
in
do
a lot of
you
cases, the outcome is favorable.
do you think someone needs to believe in the process for it to work?
Well, I feel like you're getting into like the placebo effect.
Uh-huh.
So we know that placebos can actually work. Um,
Hmm.
And so, I don't want to get away from your question though. Do you need to believe? So it would help. However, it's not required.
Interesting. Okay. Very interesting.
Considering the placebo effect, because we know it works, we know that the body has within it the ability to heal itself. So if you can tap
Mhm.
into that with something like reflexology, again, favorable results.
So, if I'm understanding you correctly, people use this usually in conjunction with other maybe more traditional approaches.
Yeah, that's a really good point, Lori. I don't know if we touched on it early, but reflexology, as well as massage therapy, in my understanding, is best as a complementary therapy to other therapies a client might be going through.
Okay. Are there any safety risks?
Yeah, there are. I mean, there's, the foot, the hand itself, you have to understand about the anatomy, and you can't make a foot do something that it doesn't. You have to work within the restrictions of the client that you see. And some contraindications would be pregnancy. That does come up because you don't want to stimulate something that doesn't need to be stimulated at that time.
Sure, sure. That's interesting. I guess that's something that you need to be aware of. Do you do an intake on your clients before you work on them?
Oh, yes, I do. An intake is very important, as well as feedback throughout the session. I rely on feedback as I work on someone. I'll do an intake form and I'll review and come up with a plan, but really it's what they're telling me, what I feel, and what they're telling me that guides the therapy.
Interesting, interesting. Do you ever collaborate with people's physician or other healthcare providers? Is there any
Well,
collaboration
yes.
with this?
Yes, we do. Because a lot of times, if someone's going through another therapy for if they're recovering from an injury, let's say, I'll have their physical therapist, their doctors give me recommendations. And that's one way that we do work together. I find, I get better results when people's team are working together. As
Sure,
like reflexology would be a part of that team, or massage therapy.
sure, sure. I have to ask because I'm nursing home administrator, long-term care executive director. So my mind is always in that realm. Do you see this useful for people with chronic conditions or someone who's aged or has those type of disabilities?
Well, as I mentioned earlier, stress management, pain management, I
Hmm.
could imagine that that would be important to somebody in, you know, such a facility.
So that sounds like a way you see reflexology really supporting somebody's whole health care.
Exactly. It's one part of a larger plan for someone's wellness.
Uh-huh. Just to explore a little bit about what kind of research, what kind of scientific evidence have you seen regarding reflexology?
Well, its history dates back thousands of years. And we know this because we've seen hieroglyphics in temples and
Oh, wow.
pyramids. Yeah.
Cool.
Of people working on people's feet, and in also its relationship to things like acupuncture, acupressure. That's kind of how it would be validated. But the true validation is to see a client's response. If it's actually working, if it's the right therapy for them, because that's an important point
Interesting.
too. All therapies are not necessarily right for everyone.
Yeah, yeah, really interesting. Tell me a little bit about the cost.
Well, that's a bit up in the air. Because
Uh-huh.
in some cases, again, let me thank you for letting me talk about reflexology, because I feel like we need to bring awareness of reflexology to the health and
Hmm.
wellness industry. So, cost, sometimes it's used as like an add on. People believe it's a foot massage. That's pretty much a common misconception, that it would be a massage. So it might be tacked on or an add on to a spa treatment. In my case, I try to elevate that to something more specific that requires more attention and more experience. So like a reflexologist would have more experience than a massage therapist using
Gotcha.
reflexology. So in some
Uh-huh.
cases the cost could be a little bit more, but I do believe it justifies the results.
So if somebody was getting just reflexology, like what would they look to pay like
Anywhere from like 65 to 150 a session. Again,
uh-huh.
it also depends upon the client, uh, what their what the outcome. may be. And is it part of many sessions? Is it a one off?
Uh-huh.
There's a lot of elements. It's hard to price it. In some cases, you don't want to price yourself out. In other cases, you don't want to give something away.
True, true. Is it something that insurance ever covers?
Well, I think the only way that insurance would cover it is if you were going through another therapy like chiropractic. You know, some
Uh-huh. Uh-huh.
chiropractors might have reflexologists, they might have acupuncturists, they might have
Uh-huh.
massage therapists. So that's really the only way that I see, unless you have a really robust insurance plan that allows you, you know, to allocate funds to something.
Uh, so what keeps you passionate about this type of work?
It By teaching it, it has revealed itself to me more. Like I had said at one point that I wanted to learn more about reflexology. And what happened is someone approached me with a position. So I said to myself, I'm going to take it and I'm going to rise to this occasion. I'm going to try to be the best reflexology instructor that I can be. So in doing that, it opened up different worlds. Opened up energy work. It opened up acupuncture, acupressure,
Mm-hmm. Mm-hmm.
chakra balancing. The list goes on and on.
Mm-hmm.
It's really, there's a lot there, and I like that. I feel like it continues to show me, reveal itself to me.
Mm-hmm. Well, I want to thank you so much for joining me today. Is there anything you'd like us to know before we wrap things up?
Yes, one statement would be that reflexology is not trying to be a replacement for medical care. That's something that comes up. Sometimes clients come in with things that I need to refer them to physicians.
Uh-huh.
So, again, as a complementary, it's most effective, but it is not a
Got you.
replacement. That when you choose a reflexologist, you should really consider their background. If they are indeed a massage therapist, have gone through a program, have completed hours, in that field.
I understand. That's important.
Okay.
Thank you for adding that.
Thank you again for having me. Again, I'm very pleased to bring awareness to reflexology. I think it's something that we're going to find out more and more as people start going for, like, looking for holistic healthcare options.
I think so. I think so. Definitely. So, speaking of bringing attention to, would you like to put a plug in for your band?
My band, Nothing Follows.
And how do I find Nothing Follows
You
if
can
I'd
find
like to
Nothing
listen?
Follows at nothingfollows.com. Yes, there is music there. Some of it is spa friendly. As you're alluding to, I am indeed also a musician. That plays a big part in who I am as a therapist as well as an artist and musician. I try to wrap all that into my sessions.
Very cool. Very cool. Well, thank you so much. I really appreciate you spending the time with me this afternoon.
Thank you, Lori.
Be good. Be well. Rock
Bye
on.
bye.